Hello everyone. Today we'll discuss tetanus prophylaxis in wound management. The tetanus is caused by the exotoxin that is produced by the bacteria Clostridium tetani. The Clostridium tetani, it is a gram-positive anaerobic organism. It is spore-bearing. The spores are present mainly in the terminal region, thus giving the appearance as drumstick. These spores are highly resistant. These are highly resistant to phenol, cresol, and boiling and autoclaving for about 15 minutes. These can be destroyed by under pressure, whether it is by steam, under pressure at 125 degrees Celsius for 20 minutes. Okay. Next we'll see the wound management. If all the wounds should be given wound care, that is surgical toilet. Next, the surgical toilet, it includes removal of foreign bodies, soil, dust and the necrotic tissues. Okay. Next, we classify the wound as clean and minor wound, and the wound less than 6 hours with negligible tissue damage. Okay. Next, we categorize the wound as A, B, C and D. The category A, I'll write it in the next page. The category A wound includes the person who has had a complete toxoid dose or the booster dose within 5 years. That is from the wound. Category B include the patient or the person who has had a toxoid or a booster dose more than 5 years within 10 years. Okay. Category C includes the person who has had a toxoid or a booster dose for that is more than 10 years. Category D includes has unknown tetanus toxoid status or not having the toxoid complete course. Okay. If the person is a category A, what is the treatment you provide? For category A, that is person who had a toxoid or a booster dose within past 5 years, you provide no treatment, only wound care. That is no treatment is no TT, only wound care. For category B, you give 1 dose of tetanus toxoid. For category C, you give 1 dose of tetanus toxoid, and for category D, you give complete course of tetanus toxoid, that is more than or equal to 2 doses. Next, for other wounds. The other wounds include the wound more than 6 hours, which have been crush injury, burns, punctured wounds, penetrating wounds, which has been soiled in dirt, saliva, fecus. Okay, here also we have the immune categories like A, B, C. For category A, only wound care is required. For category B, give tetanus toxoid 1 dose. For category C, you give tetanus toxoid plus tetanus immunoglobulin. For category C, you give complete course of tetanus toxoid with tetanus immunoglobulin.